Today on Nursing Matters, nursing leadership. Do you have what it takes? I'm Christina, and this is your daily dose. Let's get into it. Because I want to start with a question that most nurses don't ask themselves. Not because they don't care, but because no one ever puts it in front of them. Have you ever considered that you might be a leader? Not someday, not years from now, but right now. Because when most people hear the word leadership, they picture a title, a role, a position that comes with authority. But real leadership, it shows up long before the title ever does. And a lot of nurses who are already leading don't even realize it. So today, we're going to talk about what leadership actually looks like in nursing and how to know if it's something you're already doing. Right now, healthcare is facing something significant, a leadership shift. Data shows that nearly 75% of current nurse leaders are expected to retire within the next 10 years. 75%. That is not gradual transition. That is a massive leadership gap. And here's the part that you should pay attention to. Those roles, these leadership roles, they're not going away. They're going to be filled. And the people who will step into them, they are already working the floor right now. They're in your unit. They're on your shift. They're the ones people naturally turn to, who step in when things get hard, who think beyond just their own assignment. And a lot of them don't see themselves as leaders because they're waiting for someone to tell them they are. Or they think leadership means more meetings, more stress, more distance from patients. And sometimes, yes, leadership comes with those things. But at its core, leadership is influence. And influence doesn't require a title. It requires how you show up. Nurses Week is right around the corner from May 6th to May 12th. This Nurses Week, we celebrate the hands that heal, the hearts that care, and the voices that matter. Join 200,000 plus nurses building careers. Find free resources to grow personally and professionally at the RN Network. Visit rnnet.org. If I've earned it today, hit like and subscribe so I can keep showing up for you here. And for more guidance and resources built specifically for nurses, visit rnnet.org. Let's keep going. I got my master's degree in leadership and organizational development just a couple years ago, and I earned it in my 50s. Not because I needed another credential, but because I believe this deeply. Leadership done well is one of the most important contributions a person can make to any organization because leadership shapes culture, retention, performance, and ultimately patient outcomes. And I've spent years thinking and watching nurses step into leadership roles. Some thrive, some struggle. And the difference is not what most people think. It's not who had the best clinical skills. And it's not who had the most experience. It's not even who wanted it the most. The nurses who thrive in leadership are almost never the ones chasing authority. They're the ones who were already leading before anyone gave them a title. They're the ones who pay attention to the team, not just themselves, who notice when something feels off and they speak up. They support others without being asked. And they ask bigger questions about how things can be better. They're already operating at a different level. They just haven't labeled it yet. Now, let's talk about something that holds a lot of nurses back. The belief that leadership means leaving patient care behind. And that can be true in some roles, but leadership is not limited to management. There are so many pathways. Charge nurse roles, clinical educators, preceptors, specialty leads, informal leadership within your team. Leadership is not one lane. It's a spectrum. And you don't have to jump to the top to start moving in that direction. Now, let's also be honest about something. Leadership is not easy. You're navigating people, not just tasks. You're managing conflict. You're making decisions that don't always make everyone happy. and you're carrying responsibility that extends beyond yourself. And if you're someone who cares deeply, that weight can feel heavy. I've experienced it myself. But here's the reframe. That weight, it's also impact, because the right leader changes everything. They create environments where people feel supported. They feel seen and safe to grow. And we've already talked about that in previous episodes. The wrong leader can push great nurses out of the profession. So when we talk about whether you have what it takes, we're not asking, do you want power? We're asking, do you care enough to influence what happens around you? Because that's the foundation of leadership. So here's the one thing I want you to do, and I want you to answer this honestly. Who on your unit comes to you when things are hard? Not just, how do I do this task, but can I run something by you? I don't know how to handle this situation. I'm struggling with this patient or this family. Who comes to you for real conversations? Because if people are already coming to you, you're already leading. You don't even need permission. You don't need a title. You are already influencing the environment around you. And once you see that, you can start to be more intentional about it. If leadership is something you're even a little curious about, take one step this week. Look into your organization's charge nurse program, a clinical ladder opportunity, a mentorship role, or even just a conversation with someone in leadership. You don't have to commit, and you're just really exploring, because leadership doesn't start with a promotion. It starts with awareness. So if you take nothing else from today, take this. Leadership is not something you wait for. It's something you recognize and then choose to grow into. Because the future of nursing leadership is not somewhere far off. It's already here. And it's sitting in units, on shifts, in conversations happening every single day. The question is, will you see it in yourself? This is Nursing Matters, and this is how we start thinking differently about the impact we can truly have. If this episode resonated with you, send it to a nurse who others naturally turn to, because they might not see it yet, but they're already leading. I'm Christina, and I'll see you tomorrow. This is your Daily Dose. Thank you for listening to this week's episode of Nursing Matters Daily Dose. Are you interested in more career resources? Then hop on over to the RN Network at rnnet.org. Also, while you're at it, hit that like and subscribe button and share this episode with one nurse who really needs to hear it. Thanks so much, and we'll see you next time.